Hello, friends. Dr. Lindsay here, and my special guest today is personal trainer Faith G, because I can't see her last name, of
Gregorchik, it's okay.
of YouFit. We just connected last week because we are part of this really awesome women's group called Level Up, and we have a lot of strong, powerful women in there. So I am hoping to bring you more interviews from that group because there's a lot of education and knowledge and learning that can happen from that. So Faith and I met last week and talked all about personal training. So I am going to let her introduce herself and just give us a little background information about how you got into personal training, your education, that good stuff.
Yeah, for sure. I'm Faith. I studied exercise science in undergrad. Grew up as an athlete, so I always thought that I'd work with like a sports team and do like sports nutrition or something like that. But as I progressed through college, through undergrad, it was kind of when the exercise as medicine realm started kind of really kicking off, and I was super intrigued by it. Got accepted to the University of Pittsburgh as a graduate student assistant with their master's in ex-phys program. So I worked there as a mentor for the undergrad exercise science students, and then I taught a bunch of exercise classes, like Group X classes. But I focused on like a clinical population in that field, which I loved. And I just, through that experience, I found that I really enjoyed working with clinical populations. But then that athlete side of me also was super strong and just loved like any sort of functional movement, mobility, power training, that kind of stuff. So I wanted to find some sort of balance and do like a very creative, innovative training with a very specific population. So when it came time to fulfill my internship for the clinical practitioner track that I was on, I decided to come out to Colorado and work with a spinal cord injury population. So I worked with spinal cord injuries, neurological disorders, traumatic brain injuries, the whole gamut. And that really gave me a cool outlet to do very specific training that incorporated, the pillars of biomechanics and anatomy and physiology. But also, having that creative outlet and being a personal trainer because it was a one-on-one setting. So I did that for about a year, kind of bounced around between a couple different companies. And then through that, just really developed, because of kind of my creative experience or my variety of experience with a variety of populations, I decided that I wanted to start my own thing and incorporate both those styles of trainings, where you have that very innovative, very creative, biomechanically, anatomically grounded training, but then also incorporating like the fun, athletic movements, power training, functional movement, that kind of stuff. So YouFit Ltd was born from that. And then I'm in the process of collaborating with a previous colleague to work with spinal cord injury populations again. So we're hoping to fuse both those populations, create like a community experience through it, and basically develop like a system and a facility where no matter what your situation, if you come in the door, we can work with you. So, yeah.
Yeah, that's awesome. That, a lot of times when people think about personal trainers, they're like, oh, I'm going to get so jacked and I'm going to be in the gym, like lifting all these weights. And there's like such a wide variety. And like spinal cord injuries, not a lot of people would consider that they would need a personal trainer, but probably need it the most.
Yeah. And there's so much. And what intrigued me the most about it was just the research that has been happening over the past couple of years and what it's showing as far as functional, like just even like a functional movement, functional mobility recovery through exercise, through these different modalities. A lot of people can, and I've seen it, I've seen people regain some just functional mobility day to day. And at that point, you're not training for like a marathon or like CrossFit games. You're training to be able to pick something up off the floor. So it's a whole different mindset. And that population in particular, because of that, they're like training for daily life. They're very, very, very motivated. which is just, that makes it so fun as a trainer.
Yeah.
So, yeah.
Definitely. So I know you work out of a couple different places, and then you also go in home or, on location. So I guess like if I were to come in and I'm a new client, what does the like initial kind of evaluation look like?
Yeah. So what I typically do, if we can, I like to meet in person. Because I think there's just so much that happens within that interaction. I mean, I can definitely, I've had phone conversations with people, but I prefer to be there in person and kind of, again, see all the responses just right there in person. So typically, I've designed my own intake form. So I do a pretty intensive goal assessment because I think, I mean, with any sort of lifestyle change or any sort of habit that you want to instill, there's a lot of psychological and emotional factors that play into that. So I like to really just get to the heart of, okay, why? What's your motivator? What's your reasoning for starting this? And then the other big question I like to really, or the other thing that I like to talk to people about is, where do you see yourself 10 years down the road? Because in starting this, it's not a, hey, let's go and go for a couple of months or however long you can afford me. I want my huge piece of what I do. I love the training aspect, but I also love the education aspect. And I want to be able to educate people through the process of training with me. And through that, they get to gain this lifestyle skill set. So they get to train, in training with me, they get to gather these skill sets and this knowledge that they can instill throughout the rest of their life. And so when I talk to people about, we eventually start talking about scheduling, I think, okay, well, think about your life, 10 years down the road. Is this something you can maintain? Because we're trying to help you develop a lifestyle habit. And I don't want to start something that, we get super gung ho about it. And we go 7 days a week, 2 hours a day. And then a couple years down the road, that's not a feasible schedule for you anymore. I like to talk about that aspect as well, because I think it's very important for people to have that long-term, long game mindset with exercise. So we go through the goal assessment. I do like a risk assessment, just talk about what's your past experience. Have you had any surgeries? Because again, that's where that kind of functional movement and that mindset that I got through my clinical practitioner training and then working with spinal cord injuries. Everybody is unique. And every person has, even if they had like a soft tissue injury a couple of years ago, I want to know how can we, work on that throughout the session, on top of these athletic movements, on top of, whatever your other goals are. I want to be able to make sure that you're well-rounded and that you're strong in all these areas, even like those weak points. I don't think that needs to be overlooked. So we talk about that. And then depending on, again, what the client is wanting, through the program, sometimes I'll do strength testing. Sometimes I'll do like a mobility testing, especially if it's somebody who has had an injury or is coming out of surgery. I have a couple of clients that I've worked with that. So we'll do more of like a functional movement testing. So kind of from there, I cater it. It's very tailor fit based to what the client is looking for. Mm-hmm. So yeah.
Awesome. Yeah. I love that you talk about mindset and the long term and their why, because that's pretty much exactly what I focus on too. In my practice is that I'm like, okay, I know you want to get out of pain, but like, why? Like, what are you doing in the next 10, 20, like 50 years? Absolutely. So yeah, it's definitely a lifestyle skill set that needs to be learned, and you have to be like willing to learn it. So it definitely is not easy.
No, it's not. It's not. And it's not where people go right off the bat. I found, and I don't know if you found this, but I found when I've said that to people, they're like, oh, I didn't think about that. I would never have thought of that. I'm thinking right now, I'm thinking today, I'm thinking next week, and that's about it. But it's important to just throw that in because, it's not where our minds go.
Yeah. So, you could definitely treat like a whole variety of anyone from spinal cord injuries to maybe they already are an athlete to everyday like busy mom or and everyone in between.
Yes.
So where do you train at, or where can we find you?
Yeah. So I'm working towards getting a studio with my colleague that I used to work with. We're currently looking at spaces. Rent is so expensive in Denver, so it's a little, there's a little bit of a delay on that. But there's a studio. So there's a studio up here on East Colfax. It's called Rhythm Revolution. The owner is Jasmine Anderson. She's awesome. She has a really sweet space. They teach like cycling classes there and yoga and that kind of stuff. And she reached out to me a couple of months ago and said that she wanted to see kind of more of like a one-on-one, like a personal training aspect built at her spot. So that's a place where I can take clients if they don't have a space, either like an apartment gym or like space at their house, because I have equipment and I can be very mobile, and that's usually what people prefer. But if somebody's looking for, they need a space to go to, then I have that available to me, and I'll just cart equipment there and then we can use it. But yeah, other than that, I'm fairly mobile. And then hopefully again, within this year, we'll have a home base and be able to develop like my own gym. So that is the goal, and that's where we're headed. But right now I'm pretty mobile.
Okay. Nice. And before we started, I know we were talking about a lot of things that you have in the works, and not quite date set up, but tell everyone else what you're working on and all the new exciting things.
There's a couple really exciting things in the works.
Hello. Oh, think you might be frozen, or maybe it's me. Uh-oh.